Hi everyone, my name's Tracy Donegan. I'm the founder of Gentle Birth, and in this episode we're going to talk about vaginal exams in labour. Let's face it, nobody likes vaginal exams. They can be painful and unnerving and can sometimes leave us feeling a bit weird. Yes, we tell ourselves that they're just a necessary evil. It's just part of having a baby. And how many times have you heard, "Leave your dignity at the door"? So you just tell yourself to suck it up. For some moms, vaginal exams cause huge anxiety, especially if they've experienced sexual trauma in the past or vaginismus. I recently heard a nurse suggest to a mom that she consider having a sedative when labour starts so mom can deal with the anxiety and staff can do their job. Here's a radical idea. How about we reduce mom's anxiety and the risk of infection by not doing so many vaginal exams and use our other skills for recognising signs of progress. Vaginal exams aren't very accurate anyway. So let's talk about the real estate market value of your vagina. Sometimes I'll hear moms singing the praises of epidurals to other moms because they didn't have to feel the examinations anymore. As you know from Gentle Birth, I'm a big fan of epidurals and I think they're a great tool for a mom if she needs it. But for some caregivers, once the epidural is working, the market value of your vagina drops through the floor. Stay with me on this. So before you have an epidural, your vagina is considered by you, your partner, and some caregivers to be that $1 million home in that exclusive neighbourhood with amazing views, a pool, a beautiful driveway up to the entrance and blossoming trees. When you enter this beautiful home, you do so quietly and respectfully. You take off your shoes to avoid soiling the pristine carpets. It's a quiet, peaceful sanctuary. Get the picture? But once the epidural is working, your vagina's real estate value can drop to that of a cheap motel room. The doors don't always lock properly, so anyone could barge in at any moment. Visitors leave their shoes on. The decor is outdated. Strangers are coming and going. Essentially, there's just not the same respect or reverence for that space. It's almost considered public property. Realtors always talk about location, location, location. And when it comes to real estate value of your vagina, it's more about position, position, position. And the epidural can make this aspect more challenging, but not impossible with the right care provider, support from your partner, and a doula. Here's a typical scenario when mom has reached 10 centimetres and has started pushing. So the nurse or OB will say, "I'm just going to put my fingers here," and fingers are inserted into your vagina to guide you so you know where to push. I need to see if you're moving this baby and pushing effectively. When you feel that pressure, I want you to push down where my fingers are. I want you to push my fingers away. So mom is coached to push on her back with legs pulled back. But if you didn't have an epidural, you would not think this was okay. It's invasive and often painful. But because you're numbed from the waist down, you've just moved from that luxury home to the motel in the eyes of some care providers. So the care provider is pressing down firmly inside the vagina with 2 or 3 fingers, moving side to side so that she can usually just to catch a glimpse of the baby's head. And for some reason, they think it makes it easier for your baby to be born. But with the epidural, you don't have a pain feedback mechanism. If you've been doing perineal massage at home during your pregnancy, you know what your limit is, and you can feel it when it hurts, so of course you stop. I often suggest partners assist with perineal massage in pregnancy in those last few weeks. In labour, if you're experiencing no sensation, the staff can continue with that stretching with no complaints from you, and some still use oils to stretch this area. This unnecessary stretching can make your perineum bleed, as the tissues are being forcibly stretched and manipulated unnecessarily. That motel perception continues as various care providers, in training usually, glove up, apply lubricant and start to examine you without as much as a hello. With no epidural, they would have to at least ask you to get on the bed. But when you're immobile in bed, it's almost assumed that you are happy to have these examinations quite frequently. It's accepted behaviour in some hospitals. And yes, some care providers will treat your vagina like the beautiful house on the hill, but some won't. It can be quite unnerving for your partner too, as they're not used to that sudden drop in real estate value of that sacred space either. A gentle birth class can help you understand ways to navigate these scenarios. So the takeaway from my musings today about vaginal real estate value is that you get to decide the market value of your vaginal real estate, with or without an epidural, not your care provider, especially when you and your baby are well. Talk to your care provider about minimising vaginal exams in labour and during that second stage. And if they can't give your home the care and respect it deserves, maybe you need to find one who does. Don't forget to download the Gentle Birth app, and I'll see you next time on Gentle Birth TV.